For the last 60 years, modern medicine has split us down the middle. If you get sick, you are forced into a rigid choice. Do you want Western scientific precision or Eastern holistic healing? Modern allopathic medicine is a miracle for saving lives during acute emergencies. But for those managing chronic fatigue, persistent stress, or deep-rooted inflammation, the clinical experience often feels incomplete, leaving patients with a prescription for the symptoms, but no roadmap for the underlying cause. Traditional medicine approaches the body as an interconnected system, prioritizing long-term balance. Yet it often lacks the rigorous diagnostic lab tracking and measurable data that modern science requires to prove its efficacy. This gap forces patients into a cycle of fragmented care. You might spend 15 minutes in a sterile clinic on Tuesday, then spend Wednesday following untracked holistic advice, hoping the two don't conflict. Surviving a crisis is a different goal than optimizing your long-term health. To achieve both, we have to bridge the gap between emergency intervention and systemic wellness. The MedVeda database serves as the structural foundation for this bridge, mapping Western diagnostics directly to holistic treatment protocols. MedVeda replaces clinical guesswork with data. Every patient journey begins with an exhaustive investigative phase to ensure the biological reality of the body is fully mapped before any treatment is selected. This diagnostic engine processes over 100 distinct lab markers and imaging protocols. It logs everything from complete blood counts to cardiac troponin levels. Analyzing these variables simultaneously creates a rigorous, data-driven biological baseline for the individual. This ensures that when traditional healing methods are applied, they are built upon a foundation of absolute diagnostic precision. Once the baseline is established, the system moves to the treatment phase, cross-referencing two historically isolated pharmacological dictionaries. The allopathic drug dictionary provides the precision tools for immediate, acute intervention. For severe asthma, the system logs formoterol. For hypothyroidism, levothyroxine. These medications provide rapid stabilization. While these allopathic spikes provide stability, they're paired with a broader strategy. The area graph represents the Ayurvedic layer, designed for sustained, systemic recovery. MedVeda tracks these traditional remedies with clinical exactness, recording precise dosages, frequencies, and the specific anupana, or delivery vehicle. It might prescribe 5 grams of ashwagandha churna, but specifically with warm milk to ensure the active compounds are properly absorbed. This methodology transforms Eastern medicine into a quantifiable, logged science. It allows botanical compounds to function as measurable data points alongside Western pharmaceuticals. We can see the power of this synthesis in how the system handles a complex medical scenario, like a severe active infection. The MedVeda architecture deploys a targeted allopathic intervention, like 500 milligrams of amoxicillin, to neutralize the immediate bacterial threat. Simultaneously, the system prescribes specific Ayurvedic protocols. While the antibiotic attacks the infection, these traditional medicines work to protect the gut biome and support the immune foundation. Addressing the immediate threat and the underlying biological environment at the same time removes the blind spots found in fragmented healthcare. Medical protocols are shifting away from isolated treatment plans and toward integrated data. Optimizing your health demands exact dosages, hard data, and a system that can track how modern science and traditional wisdom work in tandem. You have one body. Instead of settling for a fractured approach to your care, you can choose an architecture built on total integration. Share this video with someone who is looking for a more comprehensive way to manage their health.